On.
Hand hygiene. Knock knock. Hi, I'm Ginger. I'm going to be your student nurse. I'm going to be doing a head-to-toe assessment just to verify what's your name and date of birth. I'm checking the wristband during this.
Granting Garcia, August 28, 2006.
Perfect. Do you have any allergies?
Nope.
All right. First, I'm going to be assessing your neurological system. I'm going to ask you a few questions. So, where are we right now?
In a hospital.
All right. What day of the week is it?
Sunday.
What am I here to do?
Head to toe.
Perfect. Patient is alert and oriented times 4. They are cooperative, responsive to my questions. General movements are smooth, rhythmic, coordinated, even, and patient is well-nourished, well-groomed, and speech is clear and distinct. Could hear me intact bilaterally. All right. So I'm going to have you do a couple facial expressions for me. So I want you to raise your eyebrows. Perfect. Bring them down. Close your eyes tightly. I'm going to add resistance. Keep your eyes closed. All right. Smile, no teeth. Frown. Smile with teeth. Perfect. So facial movements move symmetrically, even and coordinated with facial expressions. I'm going to have you puff up your cheeks like this. Perfect. I'm going to expel the air out. All right. Air expels equally bilaterally. Again, facial nerve is intact. I'm now going to do the Perla test. Usually I turn the lights off. I am unable to do so, but turn lights off. I'm going to be shining this pen light into your eyes twice per eye just to measure your pupil size first. Okay, pupil size is 3 millimeters, which is within normal size. Again, look at this ear right here. I'm going to be shining this light into your eye. Perfect. This ear right here. Alright, so Perla is intact bilaterally, meaning pupils are equal round, reactive to light, and accommodate properly. I'm going to have you focus on the TV behind me. Perfect. And then focus on this pen light. Again, Perla is intact bilaterally. Alright. I am now going to be assessing your cardiovascular, or actually I'm going to be assessing your gait. So if you could stand up for me. Alright, I'm going to have you walk straight in a line over there. When you walk back to me, walk on your tippy toes. Alright, walk on your heels to that box. Walk heel to toe like this towards me. Perfect. You can have a seat. Gait is smooth, rhythmic, even coordinated. No need for assistive devices. We are now going to conduct a light touch sensation test. So when I'm going to have this cotton ball. I'm going to touch a part of your body. When you feel like cotton ball, say yes. This is what it's going to feel like. Close your eyes for me, and actually say now out loud.
Now, 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 now. Now, 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 now.
Perfect. Light touch sensation is intact bilaterally in both the upper and lower extremities. Alright, I'm now going to be assessing your cardiovascular system. I'm going to inspect the skin. It's consistent with ethnic background. I see no redness, swelling, lumps, or deformities. Alright. Perfect. And now, skin looks warm and dry. I'm now going to auscultate the heart sounds. So I'm going to use 5 precordial sites. First, starting with my diaphragm. This is going to be aortic, which is the second intercostal, right sternal border, pulmonic, second intercostal, left sternal, herbs, third intercostal, costal, left sternal border, tricuspid, fourth intercostal, left sternal border, and then mitral, which is the fifth intercostal, left midclavicular line. This is where the apical pulse is found. Perfect. I'm going to listen for 60 seconds, 1 to 60. Okay, apical pulse is 60 beats per minute. That is within normal range, indicates strength and regular rate and rhythm, and there was no sign of murmurs, bruits, gallops, or rubs. All right, I'm now going to listen back up using my bell. I will start left, going right. So I'll start at mitral, then tricuspid, then herbs point, then pulmonic, then aortic. S1 and S2 are present. All precordial sites, and S3 and S4 are not present. Okay. I will now be assessing your peripheral vascular system. So just inspecting first your upper lower extremities. Legs and arms are symmetrical bilaterally. The skin is consistent with ethnic background. I don't see any redness, swelling, lumps, or deformities or masses. All right. Now going to be palpating for temperature. All right, temp. So skin is warm and dry bilaterally in both the upper and lower extremities. Going to be assessing for tibial edema behind the calves. There is no presence of tibial edema. I'm now going to be feeling for your radial pulse. So if you can stick your wrist out, be listening 1 to 60. 1 to 60, your pulse is 60 beats per minute within normal range, graded a 2+ for strength, indicating regular rate and rhythm. I'm going to do that with the pedal pulses too. 1 to 60, graded 2+, indicating strength, regular rate and rhythm, 60 beats per minute, which is within normal range. Of course, if I touch feet, I will be hand hygiening when touching other parts of the body. Alright, I will now be assessing capillary refill. Stick your fingers out like this. Perfect. Alright, capillary refill is present and refills in less than 2 seconds. Gonna do it with the toes. Capillary refill is present and refills in less than 2 seconds. Perfect. I will now be assessing your respiratory system. So I'm just gonna inspect anterior and posterior thorax. Anterior thorax skin for both of them is consistent with ethnic background. I don't see any redness. The thorax is symmetrical, elliptical shape, evenly spaced intercostals, costal angle of 90 degrees, downward sloping ribs. Alright, I'm now going to palpate the thorax, both anterior and posterior. So please let me know if there's any tenderness. No tenderness?
Nope.
Got you. Perfect. Make sure trachea is midline. Trachea is midline in the throat. Anterior thorax, no lumps, masses, deformities. It's non-tender, no pain. I'm now going to palpate the posterior. Perfect. Any pain or tenderness?
Nope.
Alright, posterior. The shoulders are symmetrical, and again, no lumps, masses, or deformities. And skin is warm and dry for both sides. I am now going to assess your respiratory rate. Can I have your arm over your chest? I'm going to put my hand on top of this. I will watch for 60 seconds to see how many breaths I take. Okay, so you can put your hand down. You took 12 breaths per minute, which is within normal range. Your breathing was euphonic, unlabored, and even. So I will now be auscultating for lung sounds. Usually I ask the patient to breathe in every time I put the stethoscope to their chest. For sake of time, I'm going to show you the sights. So 1, 1, 2, 2, 3, 3, 4, 4, 5, 5. I'm going to have you turn this way so I can see your back. Perfect. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9 laterally. Alright, all lung sounds were clear, audible, and present in all lung fields, and no adventitious sounds. I will now be assessing your gastrointestinal system. So, I'm going to start with your mouth. I'm going to have you smile with teeth for me. Alright, open your mouth. Stick your tongue out, say ah.
Ah.
Perfect. Alright, lift your lips so I can see your gums. Perfect. So there is no halitosis present. The tonsils are peppered with indentations, graded 1+, which is healthy, pink, moist. And the teeth are white, straight, evenly spaced, free of decay, free of debris. The gums are pink, moist, with well-defined margins. Buccal mucosa, pink, smooth, moist, bilaterally. The tongue protrudes midline. Dorsal side is rough with papillae, ventral side is smooth with veins and saliva. And again, hard palate is white with transversal rugae, soft palate, pink, smooth, moist, moves upwardly. Alright. I am now going to assess your ability to swallow, so swallow for me. Perfect. Ability to swallow is intact. I'm going to have you lie down. I'm going to inspect your abdomen. So looking at the abdomen, the contour is flat, smooth, and even. I don't notice any lumps or tenderness. We'll be palpating for that. Skin is consistent with ethnic background. Alright. Umbilicus is midline and inverted. Alright. First, I'm going to check for skin turgor. Alright. There's no tenting, so that is a good sign. I'm now going to auscultate the bowel sounds in all 4 quadrants. So I would start with right lower quadrant, making my way up. So left upper, and then right upper, right lower. So making a circle. Bowel sounds are normal active, all 4 quadrants. I am now going to palpate. So I'm going to start with light palpations. Let me know if there's any tenderness or pain. Perfect. Any tenderness, pain?
Nope.
Got you. So abdomen is soft, non-tender. He's not rigid. Superficial musculature is present though, but minimal muscle guarding. I will now be doing deep palpations. So breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Alright, so there is no enlarged organs. Spleen is not palpable because patient is healthy. Alright, I can have you sit up for me. I'm now going to be assessing your musculoskeletal system. I'm going to have you actually stand up for me. So, if you could clench your teeth, perfect. I want you to open your jaw all the way, close it halfway, move it side to side. All right, protrude forward. Perfect. Open your mouth, move side to side. Perfect, this side. All right, I'll now be assessing cervical spine, so chin to chest. Perfect. And then put your head all the way back where you look up. Bend this way, bend this way. Perfect. Turn this way, turn this way. Perfect. All right. Now I'm going to add resistance. So go forward, go backward, bend this way, turn this way, turn this way. Perfect. I'm now going to assess your thoracic and lumbar spine. So bend forward, touch your toes. Perfect. All right. Stand up straight, bend side to side, rotate side to side, and hyperextend back. Perfect. The spinous processes were midline and even. I'm now going to assess your shoulders, so shrug. All right, I'm going to put those down. I'm going to add resistance, shrug. Perfect. I'm going to have you bring your arms straight forward, straight back. Bring them to your side, bring them outward. All right, and then circumduct like this. So bring them down, bring them out again, bring them forward, bring them backward. All right. And I have you do this with your shoulders and this with your shoulders. Perfect. I'm now going to be assessing your elbows. Can I have you extend, flex? Perfect. So extend, flex. All right. I'm now going to be checking your wrists and your fingers. So I'm going to have you go up, go down, out, in. I'm going to be doing resistance now. Up, down, out, in. Perfect. All right. And then with your fingers, can you I'm going to have you grip both of my fingers. Perfect. All right, grip strength is intact. All right, I'm going to have you flex your fingers, bring them out, spread them apart, bring them in, adduct them, and then circumduct your wrists. All right, I'm going to have you sit down. I'm going to assess your hips now. Swing this way. All right, so I'm going to have you raise your leg up, raise it down, bring it out, bring it in, knee to chest, out, in. All right, I'm now going to add resistance. So up, down, out, in. All right, so this leg up, down, out, in. Knee to chest, out, in. I'm going to add resistance. Up, down, out, in. Perfect. I'm going to have you swing your legs over to assess your knees. I'm going to have you bend them forward or extend them straight and flex them. Perfect. Bend or extend and bend. Perfect. Now I'm going to assess your ankles. You can have them hanging a little bit. I'm going to have you circumduct when you bring your feet down, up, out, in. I'm going to do that again. So down, down, up, out, in. With your toes, can I have you do this with your ankles in? And then with your toes, can I have you abduct them, adduct them? I'm going to have you flex them, unflex them. Perfect. All right. So full range of motion, 5 out of 5. So I'm going to make sure with your wrist, right? So we bring them up, down, out, in. Perfect. So, all right. I'm going to now, 5 out of 5 range of motion. All of the joints, so TMJ, cervical, thoracic, lumbar, shoulders, elbows, knees, ankles, and toes, and fingers, and wrists. Again, 5 out of 5 range of motion, no clicking, popping, or crepitus in those joints. All joints were warm, skin was consistent with ethnic background, and no tenderness. And then just assuring I got everything. Screw hearing was intact. Shoulders were symmetrical when expecting the thorax. And then all the joints, perfect. Eyes bilaterally, perla bilaterally. All right, perfect. Thank you so much for your time. Thank you for your time.